How can you detect silent atrial fibrillation? Imagine feeling perfectly fine but still having an irregular heartbeat that could put you at risk for a stroke. Silent atrial fibrillation is exactly that, episodes of irregular heart rhythm that happen without any noticeable symptoms. Because it often goes unnoticed, detecting it can be tricky but is very important for stroke prevention. One of the simplest ways to start is by feeling your pulse regularly. If you notice an irregular pulse, especially if you are over 65 or have risk factors like high blood pressure, diabetes, or a history of stroke or heart disease, it's a sign you should see a healthcare professional. They can perform an electrocardiogram, which records the electrical activity of your heart. A standard ECG can confirm atrial fibrillation by showing irregular atrial activity and an irregular heartbeat pattern. However, since silent atrial fibrillation can be infrequent, a single ECG might not catch it. That's why doctors often recommend longer monitoring methods. A 24-hour Holter monitor, which you wear like a small device, continuously records your heart rhythm over a day. If episodes are rare, longer-term monitoring might be needed. Implantable loop recorders are tiny devices placed under the skin that can monitor your heart for months or even years, providing detailed data to detect intermittent episodes that might otherwise be missed. Wearable technology has become a helpful tool as well. Smartwatches and fitness bands equipped with sensors called photoplethysmography can analyze your pulse for irregularities. If the device detects something unusual, it can alert you to seek further testing. These devices are non-invasive and easy to use, making screening more accessible. Advanced algorithms now help improve detection. They analyze signals from ECGs or PPG sensors to identify patterns consistent with atrial fibrillation. While these tools are promising, they still require confirmation by a healthcare professional to ensure accuracy. If silent atrial fibrillation is suspected or detected, additional tests are often performed. An echocardiogram can evaluate your heart structure and function, helping to understand why EF might be occurring. Blood tests, including thyroid function tests, are also common because thyroid disorders can trigger irregular heartbeats. Overall, detecting silent atrial fibrillation involves a combination of risk assessment, pulse checks, and advanced monitoring techniques. Because of its link to stroke, early detection is key. If you have risk factors or experience irregular pulses, consult your healthcare provider. They can guide you through appropriate testing and help determine if treatment like anticoagulation is needed to reduce your stroke risk. Remember, personalized care is essential, so always seek professional advice for your specific health situation.